Dear students, we will just have a look at the clinical sign called a skip lesion, which is very typically observed in the peripheral artery disease, where limb is critically ischemic, where maybe in the foot gangrene will be there, but apparently looks proximal to that area normal. But further proximally there will be a patch of darkened or gangrenous patch. They are called as skip lesions. That means disease is progressing proximally, ischemia is progressing proximally, and it is also considered as a severe arterial disease. So that's why these skip lesions are very typical. That before discussing about that, we'll just go through the MCQs. The Leries syndrome is A, B, C, D. To put the right answer in the comment box, I appreciate your answer. So second MCQ is commonest artery involved to cause intermittent claudication of the lower limb is superficial femoral artery, D femoral artery, popliteal artery, tibial artery, or ABCD. Students, put the right answer. I appreciate your answer and acknowledge your answer and put the right answer later. Students, I request you to subscribe my YouTube channel, share with your friends and colleagues, press the bell, and view the daily lectures of 5 to 10 minutes, wherein X-rays, images, instruments, operative procedure, clinical cases or instruments, everything is there, so that learn the daily, on day-to-day daily basis, surgery for brief period, so that you can enjoy the learning surgery in a better way, and also join live session in my YouTube channel for once in 2 to 3 weeks, wherein student will present a case, 1.5 hour interactive session, so that we will learn. Suppose hernia or breast lump presenting a student, and live session will be there. Other than myself, senior faculty will be joining the session, so we'll have interaction with that, so that if you join the live session, you also will get a certificate of joining, which will be very useful for your future career. And so please again subscribe my YouTube channel and share with your friends and colleagues. Put the right answer, students. So what this clinical entity is, see that here ischemic gangrene is there, foot is extending like this, there is again lesion here, looks apparently normal this area. See the area here, see the area here, there is a blepsar there, some serous fluid is coming there, this is a dark patch is there. So these are called as skip lesions. Very typical of progressive arterial disease in a critical limb ischemia. So limb is critically ischemic. So definition of critical limb ischemia I am not going to discuss, please go through my manual. Critical limb ischemia, functional limb ischemia, gangrene, necrosis, sequestrum, slough, all these definitions you have to know, and also how to manage this critical limb ischemia. Arterial Doppler is a non-invasive method initially, then always you have to do a dynamic CT angiogram. If you want to do a interventional procedure, then conventional angiogram is required while doing the interventional procedure. So when you use conventional angiogram, when you use dynamic CT angiogram, and what findings you look for in the CT angiogram, corkscrew appearance, blockage, collaterals, distal runoff, all these things are important. Questions will be asked in the exam. In a long case, in a long question will be asked in theory also. Lot of short notes will be asked in theory, gangrene, necrosis, all the things. Also you should be able to define, and it's a long case always in the exam. So many questions will be asked in the theory also. Why also they will ask, Oxy they will ask, MCQ they will ask. So very, very important topic. Skip lesions meaning you have already told. So remember all these things, it's very, very important. You can go through my manual of surgery in arterial disease, gives detail about everything about ischemia, critical limb ischemia, functional, acute ischemia, and so on. So you can go through my clinical method of surgery to examine how to this patient, how to examine peripheral pulse, how to examine this ischemic limb, and so on. And so quotation of the day is: small but consistent efforts can make big changes in life. Again, it is consistency, it's not effort. It's not hard work, it's a consistent hard work, not one day work, it's a test match. Daily you have to do a hard work to come up in life. It's very useful for surgeons. And again, students, have my manual of surgery, which covers CBME syllabus, every topic, endocrine, got a footnote, it took a lot of photos, etiology, pathology, investigation, treatment aspect, a lot of diagrams, illustrations, tables, everything, and covers everything as per CBME syllabus. and it also has got an instrument briefly, operative surgery, anesthesia and other chapters, whatever required as far as surgery is considered. And each chapter has got a online MCQs. If you click online, MCQs will come, which is useful for your facing the NEET exam, learning surgery, and any competitive exam. It will very, very useful. So that manual of surgery, SRB's manual of surgery currently is the best book for surgery and very, very useful to learn surgery. And also I have my clinical methods in surgery, which how to examine a patient. Lot of photos of examining with the video with the QR code in each chapter, so which gives a brief 20 minutes video how to examine a patient, like hernia, like thyroid, like breast lump, like artery disease, how to examine this is there in this chapter. Lot of photos and how to examine, and discussion of examination will be there with the differential diagnosis in a tabular form, so that you can recapitulate well in the exam. But there are no investigation and treatment because it's a clinical book. It also contains instruments and pathology specimen. So everything is covered: general examination, general vascular disease, venous disease, thyroid, breast, mass abdomen, rectal examination, briefly orthopedic. Everything is covered. Very, very useful. The best clinical method book currently available. So please have this book. And again, request to students, subscribe my YouTube channel, share with your friends and colleagues, and learn surgery on day-to-day, daily basis. Also join live session whenever it is there to improve your surgical knowledge as such. So students, I hope you have understood this topic very well, and thank you so much.